So we're going to continue with our aerobic training unit by talking about cardiovascular adaptations. So we've got two main objectives, but there's quite a lot of information that I'm going to throw at you with this video. Okay, so when we begin aerobic training, a lot of things happen to our cardiovascular system. So we have changes to heart size, stroke volume, heart rate, cardiac output, blood flow, and blood volume. Now remember, the goal of the cardiovascular system, or actually the purpose, the function, is to be able to deliver stuff, right? And so as we go through each of these 6 things, think about how is this going to affect my ability to deliver, okay? And so as you're thinking about this, or as you're listening, you're probably going, well, it's going to make it so I can deliver more, deliver faster. That answer is absolutely correct, but you want to be specific in being able to explain how these things work. And really, a lot of these are intertwined, okay? And so hopefully you can figure out and understand that and be able to explain this. Okay, so to start off, heart size. Your heart's a muscle. You use it more, it gets bigger, okay? And so this causes what we call left ventricular hypertrophy. Okay, so the ventricle itself gets bigger. This is good, assuming that it happens the correct way. Okay, if I've got a bigger muscle, it can produce more force. Okay, and what's really important when we have ventricular or cardiac hypertrophy is that the chamber size increases. Okay, there are people that have heart disease that have cardiac hypertrophy, but what happens is the heart muscle gets bigger, which is great, but the volume of the chamber inside actually gets smaller. Okay, and what happens is you get really thickened walls. Okay, that's not what's happening here with changes due to aerobic training. Now, because we have an increased chamber size, we have an increased preload. Okay, the chamber, the ventricle, can hold more blood. Okay, what's also going to happen is that we have an increase in filling time. Well, how can that happen? The answer is we have to have a decreased heart rate, which we'll get into in just a minute. Okay, so the fact that I've got a bigger bucket, and now that I've got more time to fill up the bucket, I'm going to be able to get rid of or dump more water out of the bucket. That's essentially what's going on when we increase heart size. All right, so how does this happen? Well, it happens in 2 ways, this change in heart size. We have eccentric hypertrophy, okay, and so this is where we get the increase in volume. All right, and then we have the concentric hypertrophy, and so notice that the walls here are this thick. It could help if I could draw a straight line. And now we've maybe doubled them in thickness. That's concentric hypertrophy, and so what happens there is we're just adding more actin, more myosin. And that's great because the wall's thicker, we can produce more force, right? More cross bridges, more force. Now, we've talked about this a couple weeks ago, stroke volume. Okay, notice what happens to stroke volume as we train. Okay, now there's a couple of things that, one, post-training compared to pre-training, stroke volume is actually slightly higher. Okay, so that's one change. And then the other thing is you notice that the post-training actually has a much greater stroke volume compared to pre-training. Okay, and in this case, it's almost 50% greater. And so endurance training helps improve stroke volume. And so there's a couple of reasons why. Again, remember I said I want you to talk about how or understand how all these things are related. Well, I increase blood volume, which we'll get into later. If I have more blood floating around, then I can fill my heart up with more blood. Okay, I've already told you that I'll increase the volume of the left ventricle. Well, if I've got a bigger bucket, that can hold more fluid. All right, and then we've got the increased contractility. The heart, our thickened walls, our stronger walls, our walls that have more cross bridges, can now contract harder so I can get more blood out of my ventricle. In other words, I can get more fluid out of the bucket. All right, now we have a heart rate. So again, look at these figures. So a lot of figures in this video. Okay, so again, intensity on the x-axis, and in this we have heart rate. So notice what happens with heart rate between pre-training and post-training. Okay, now if you look for a given intensity, heart rate's actually a little bit higher before training. Remember, high heart rate, low filling time, low stroke volume. But after training, heart rate's reduced a little bit. Low heart rate, more filling time, more preload, greater stroke volume. So it kind of compensates for it. It compensates. And so the way this works is our endurance, when we train, we increase stroke volume for reasons that we've already discussed. We've actually got decreased intrinsic stimulation. Remember, intrinsic, the stimulus is coming from the heart itself. Well, now that stimulation is reduced, okay? And so the drift is it has a less steep slope, and so it takes longer for us to hit threshold. And so as a result, heart rate's slower, which means we have a greater heart rate reserve. And then heart rate max doesn't get higher. If anything, it's maintained, maybe even decreased a little bit. But we're making up for that with our increase in stroke volume. Another thing to look at that's important is our heart rate recovery. Okay, so this is when we're exercising. So we've got time on the x-axis, so that's exercise. This is recovery here. Here's our heart rate. Again, notice before training, heart rate is higher for a given intensity, and it's that way for most of this. But notice that as soon as we're done exercising, heart rate goes back to normal much quicker in the post-training. Okay, so, and the reason that this works, or this is one of these changes, this is nice because then we're becoming more efficient. So there are some things that can delay recovery, such as higher core temperature. Remember, temperature increases metabolic activity. Increased sympathetic activity can also increase it. But when we're training, we can get back to normal. We can be more efficient and utilize oxygen at a demand or a level that we need. So cardiac output. Okay, training doesn't change cardiac output at submax. Remember, a given intensity requires a given amount of oxygen. And so if it's going to take 5 liters of oxygen or 5 liters of blood to deliver the appropriate amount of oxygen, it doesn't matter if I'm trained or untrained. However, cardiac output increases at maximum workloads. And this is the biggest training adaptation that happens with aerobic training. Okay? And how does this work? Well, we've already talked about it, maybe not talked about it directly, but our cardiac output can increase because our stroke volume increases. All right, and so if, again, we come to this figure, again, intensity on the x-axis. In this case, we have cardiac output on the y-axis. For all intents and purposes, they're on top of each other, right? We're just trying to make sure that you show that they're really close. But notice in this person, they're getting up to about 28 after training, whereas their cardiac output before was 20. That's an increase of 40%. Okay, not to say that that's typical or normal, but as a result, this person is able to exercise at a much higher intensity. Okay, they're running 21, 22 kilometers an hour, which is 13, 14 miles an hour, as opposed to here where they're only running at 20 miles an hour, which is 11, 12 miles an hour. Then there's blood flow. When we exercise, we send more blood flow to the muscle. That makes sense. But as we train, we want to become more efficient, and so we do this several ways. We increase our capillaries. We're able to recruit more capillaries. We are better able at redistributing this blood flow. We have increased blood volume, right? And we've already talked about how increased blood volume will lead to an increased stroke volume. Okay, and we're going to get into how that increased blood volume occurs in just a minute. So with capillary density and recruitment, endurance training causes us to create more capillaries. And this is good because then we're able to get more oxygen into the muscle cell. Okay? And so more capillaries, more oxygen into the muscle cell, more oxygen in the muscle cell, the more ATP we can create through oxidative pathways. Blood flow redistribution. Okay? So when we train, we become better able to redistribute blood flow. Okay? And there's some evidence to suggest that we're better able to distribute blood flow to oxidative muscle fibers compared to glycolytic. And how this is possible is due to what we just talked about on the previous slide. If I've got more capillaries in my oxidative fibers, they're going to be able to take up oxygen more easily. Okay? And so as a result, more blood flow, that sort of thing. The last thing is blood volume. Okay, when we exercise, we increase our total blood volume. We do this two ways. One, we increase our plasma volume. Okay, so in this case, we're going from 2.8 to 3.3. We also increase the total number of red blood cells that we have. So in this case, we're saying we have 2.2 liters of red blood cells, and after training, we go up by 10% to 2.4. Okay, so as a result, we're better able to carry oxygen. We have more spots for oxygen to bind for us to deliver oxygen. Okay, now if we're able to increase our hemoglobin concentration by 1 gram of deciliter of blood, then we actually increase our oxygen capacity by 1.34 mils of oxygen per deciliter of blood. Again, I know that that's a weird measurement, but if you did the math, 1.34 is about 5%, 5 to 7% of 20. Okay, normally we're carrying about 20 milliliters of oxygen per deciliter of blood. Okay, and so hopefully as we've gone through this, you can see how all of these things are related to make our cardiovascular system much more efficient during aerobic exercise.